Good evening, everyone, and a warm welcome to this evening's webinar entitled Prevention versus Cure, Your Health and What You Really Should Know. My name is Kelly Travelay-Hack, General Manager of Canning's Employees Credit Union, and I will be your moderator for this evening's webinar. Happy Credit Union Month to all. The month of October is Credit Union Month, and this year we want to focus on members' health and preventative care. As the old saying goes, prevention is better than cure. Before I introduce you to our presenter, just a few housekeeping rules. Microphones will be muted during the presentation. However, if you have questions, you can place them in the chat box during the presentation and they'll be answered during the Q&A. During the Q&A session, if you would like to ask a question, you can raise your hand and your mic will be unmuted. If not, you can utilize the chat box. Dr. Asante Van West Charles Le Blanc is a Cuban-born Guyanese mother of five, wife, doctor, clinical densitometrist, and medical herbalist. One of her passions is to help guide individuals on their road to optimum health. So she integrates complementary traditional medicine with conventional Western medicine. After losing her grandmother to cancer, she decided to do something more for persons affected by this terrible disease. So she began working with the Trinidad and Tobago Cancer Society, where she is the former chairwoman of this country's longest standing NGO and currently serves on the board as a director. Dr. Le Blanc is the founder of Victoria Clinic, and over the years, she has been called on by many groups and organizations as a medical keynote speaker for staff engagement events and activities. Dr. Le Blanc, you are no stranger to us here at CECU. Welcome, and we now hand things over to you. Doctor, we're not hearing you. Microphone.
Oh, would help if I turn on the microphone. Good evening. I was wondering, I was talking to myself. I was like, no, oh my gosh. All right. So happy Credit Union Month. I didn't even know that was a thing. But I'm so excited to hear that. And so excited that Canning's Credit Union is looking towards prevention and promoting via education and empowerment, preventative medicine. So without further ado, I'm going to share my screen and we can get into it. Allow. And let me get my screen and then I'm going to pull up my presentation. And Kelly, you can tell me if you're seeing it. Everything is okay?
Yep, everything's looking good.
Okay, perfect. I'm getting better at this, I think. Oh my gosh. Yeah. So I always like to start my presentations by saying, what is health? What is the definition of health? Because this is important for us to understand when we speak of prevention, when we speak about medicine and illnesses, we have to understand what health means. Health is, in very, very simple terms, the balance of body, spirit, and mind or soul. And that is to tell you that one can't work without the other. So as like take two hands to clap, that's health. We need all aspects to be balanced in terms for us to be healthy. A lot of us have heard about lifestyle diseases or the word NCDs or chronic non-communicable diseases, or when we had the dreaded pandemic, it was called comorbid conditions. So what are lifestyle diseases, which is what plagues most of our communities worldwide, regionally, and in Trinidad and Tobago? Lifestyle diseases are just what they say. These are any medical condition that is attributed or attributable, at least in part of, to our lifestyle choices. Yeah. And the classic examples or the greatest examples are hypertension or pressure, diabetes or sugar, obesity or selective plumpness, heart disease, dyslipidemia or cholesterol, chronic lung diseases, and cancer. Now, why am I touching on that? And why? Because this whole topic is prevention versus cure. And this is because lifestyle diseases or NCDs are now the greatest killer in Trinidad and Tobago, in the Caribbean or our region, and worldwide. And it is a mandate from WHO PAHO and all our leaders that we have to stop this and break this cycle. And this means that there are pillars that we have to look at. And one of the biggest foundation pillars is our lifestyle choices. 80% of the deaths in the low to middle income countries, and we're saying that because we are considered in this region low to middle income countries, but it's the same thing almost in the higher income countries such as the United States and Canada. 80% of the deaths are due to lifestyle diseases. And a quarter of those deaths worldwide before the age of 60. And I want that to sink in because when I used to work in pathology, we saw younger and younger people dying owing to lifestyle diseases. Now, lifestyle diseases, I was sharing with a colleague today, we speak to everyone and we say, man, eat properly, exercise, do this, improve your lifestyle. And then they go, well, if I can dead, I can dead. And what we're saying now is that most times we're not seeing immediate death. So what we're seeing is complications, and people are now being left with severe complications, be it amputations, renal disease or kidney disease, heart disease, all these things. And then they finally will die. But during the years of living through the complications, it becomes economically and financially crippling to not only the patient, their family, but also to the society on a whole. And lifestyle diseases do not discriminate. They don't care if you're red, white, black, yellow, identify as a bush, a fly, or a girl or a boy. They will hit you if you are not doing what is right. And coupled with not doing what is right is your ancestry and your heritage. Yeah. So prevention is definitely better than cure. We've heard our grannies tell us an ounce of prevention is worth more than a pound of cure. An apple a day takes the doctor away. And this is where primary healthcare prevention is key. And this is what we're doing today. We're empowering you and educating you so that you have that in your mind. And not only that, I want you to know what to ask the doctor, what you really need to know. Not only what Chat GPT tell you, Google tell you, whoever Tanti tell you, but what is it you really need to know? Because if you look at anything now on Google, and after we finish this presentation, your smartphone will pop up and tell you. You'll think everything will kill you and you'll put up your hand and say, well, I'm gonna dead anyways. But that's not what we want. We want to empower you to understand what you really need to know and basically demystify and debunk all the myths that may be out there. Not all, as many as we can. So, what are our lifestyle choices? Our lifestyle choices start with our diet, what we eat, portion control, the quality of food, exercising, smoking and vaping, very important when we talk about lifestyle, how we sleep, how is our sleep cycle, stress management and stress coping. Because when we have poor coping mechanisms, then our body is in a prolonged stressful period. Then it's in a prolonged fight or flight period. And what that means, the dreaded word that you hear if you don't sleep at night is inflammation will kill you. And now I saw the ad saying everything is an itis, and itis means inflammation. So this is what it is. And you remember the definition of health, the balance of body, mind, and soul or spirit. And this is where stress coping has to come in and plays a major key and helps your body then heal and restore during the evening, especially. And then alcohol intake is also a big lifestyle choice that we have to look at. So I want you to let that sink in because these are the big boys. These are the big ones we have to look at. And these are things that you have heard probably from since you're a baby, but you're just like, oh, well, whatever. But the reality is that more and more research has been done. We're seeing the results. We're seeing what's happening. And we have to, at some point, take control, be proactive in our journey on the way to optimum health and wellness. So let's talk about hypertension or pressure. What is the ideal blood pressure? Now, your blood pressure has two components, the systolic and the diastolic. The systolic is the top, the diastolic is the bottom. So what happens? What is a normal blood pressure? Well, the guidelines have come out lately. Big Pharma has come out and they're saying, oh, we want blood pressure below 135, 89, or 85. But the reality is we are accepting a blood pressure to be normal, anything below 140, 90. So when is it considered that you have high blood pressure or hypertension? When we get three readings at three different times of your blood pressure higher than 140/90, that is when we consider you to be hypertensive. Now, please note there are some of us in the audience who do not like doctors and you have normal pressure home. The minute you hit a doctor's office, your pressure gone up. And that is called white coat hypertension. So that's a different category. So with blood pressure, what it is that the blood, when the blood is pumped from the heart to the body, that pressure, just as it leaves the heart into the aorta, is called your systolic. And when it comes back into the heart from the body, that in to feed the heart, then it's called your diastolic. And so those are the two things we're looking at. The important thing about blood pressure is that blood pressure is like when you have a hose, then if you think of a wasser pipe, right? And if you shoot in high pressure of water through that pipe, it's going to damage the inside of that pipe, and then the calcium is going to build up, and then you're going to see a plaque, and you're going to see the pipe getting smaller and smaller. But as it gets smaller and smaller, the brain is saying, oh gosh, I'm not getting blood here. Oh gosh, this one telling the brain I'm not getting blood here. So then the brain says to the heart, what the hell are you doing? Pump harder. And it's a very vicious cycle. And that pressure keeps going up and up and up, and then can cause the following strokes, which is very clear. You may not have a full out stroke. You might start with a TIA, which is the warning, and then you get the big boy, a heart attack, kidney disease or failure, eye problems where you could get retinal detachment, you could get hemorrhage in the back of the eye, circulation problems in the legs for sure, and for the men especially, impotence or erectile dysfunction. The important thing to understand with pressure, there are two things that link to give you high blood pressure, and we have one aspect that we can have control over and we can modify, and that's our lifestyle choices. But we also need to understand our family history, because if you have high blood pressure in your family, in terms of mommy, tanty, daddy, granny, all of those, then you know it's not written in the stars that you'll be hypertensive. But if you have that information and you know that information, then you already can build on that foundation with healthier lifestyle choices to then prove the genetics wrong and not succumb to having these diseases, but not only that, to not having complications and end organ failure, which is ultimately what we need to do. So if you look here, and if you see here, this is the normal artery I was telling you about. And now the thing we have to understand is that none of these diseases happen in isolation. So blood pressure could be related to sugar, or diabetes related to cholesterol, vice versa. And all three of them could come together, related together. And then we have selective plumpness and obesity. So what I'm trying to tell you is every single thing can be connected. So here we look at a normal artery, but then if the pressure is too high, then it could damage the inner layer here, which is called the endothelium. And with that damage now, as all the blood cells and everything passing through in the blood, the platelets will see that damage, and our body is such a miraculous organism that it will say, oh shucks, let me try and fix that. And when it tries to fix it, in trying to fix it, well, this is where, you tap a hole and you make more problems. We all know these problems. So it tries to fix it, and it starts to have clumping of different platelets and different elements. And then the body says, oh, is that inflammation I see? Is that something that needs to be cleared? And it sends more inflammatory warriors out there. And next thing you know, cholesterol coming through, and cholesterol says, oh, I think I should stick here. And it goes on and on and on. And bada bing, bada boom, we have worsening scenarios of high blood pressure. Generally, well, this is just for us. We take blood pressure this way. I just put this slide for you to relax. I hope you're not falling asleep. So diabetes or sugar. The reason I'm going on to the disease, because after that, we're going to talk about the steps to take, because everything is similar, because they're all the same under one umbrella. And if there's specifics, then I can always tell you that as well. So with diabetes or sugar, how do we diagnose diabetes or sugar? If you have a fasting blood sugar higher than 110 milligrams per deciliter, or an HbA1c greater than 6%, but then you're considered diabetic, or a random blood sugar, that means you didn't fast and it's higher than 200, then in that case, you can be considered diabetic. Now, don't panic too much. For example, when I was ill a long time ago, and they had me on a lot of steroids, and steroids can raise your blood sugar. So they put me on the steroids, and when they take my sugar is 2 something, and they go, oh my God, you're diabetic. No, 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 no. I'm on steroids, so there's a known cause. But if there was no known cause, such as a medication putting up my sugar or anything like that, and they take my sugar and it's above 200, that is when they can classify me as diabetic. Yeah? Now, diabetes is a funny thing. We have two types of diabetes. We have type 1 and type 2. Those are the major types. We also have gestational diabetes, we have juvenile diabetes. But for adults and for us in this scenario, we have type 1, type 2. Type 2 diabetes is considered the lifestyle diabetes. So that is the major life NCD that we talk about. Type 1 diabetes is called insulin dependent diabetes. That means you need an external source of insulin to control your blood sugar because your insulin, which is produced from an organ called the pancreas in your body, is not working properly. So therefore, you have to have insulin, and that is for life. Yeah. But then we come to type 2 diabetes. Type 2 diabetes is the one most of us know. This is where mommy had sugar, granny had sugar, you might get sugar. Daddy had sugar. This is the one that we, the physicians, say to you, I'm going to give you a 3-month blight, but then it's turned into a 6-month blight because nobody wants to go on medication. But because with lifestyle changes, such as how you eat, how you exercise, if you smoke, don't smoke, no vaping, no excessive alcohol intake, or no alcohol, as a matter of fact, then we will see a big difference in how you can control your blood sugar rather than only depending on medication. And I say that to you because when we talk about prevention, we are telling you how to do it. We're saying promote healthier lifestyle habits. But when we talk about that, suppose after all of that, your genetics came in and says, look, I still can get you a touch of sugar. And touch of sugar don't mean you don't have sugar all the time. It means it's very mild and can be controlled with lifestyle modification. But the reality is, if you do your preventative testing, if you understand your numbers, then we are able to intervene earlier because we could see, is your blood sugar raising too much? Is your HbA1c going up? And what is HbA1c? HbA1c is for all of you who want to go to the doctor for your checkups. And that is the 2 days before that, you eat like a queen. You eat very clean, no, only veggies, no cake, no ice cream. And when they do the fasting blood sugar, it is perfect. And you go, see, I'm behaving myself. But HbA1c says, if you're not behaving yourself, because it gives me an idea of what your blood sugar control has been over the previous 2 to 3 months, because the sugar holds on to your red blood cells and your red blood cells die in 120 days. So I see the concentration of glucose in your hemoglobin, which is in your red blood cells, and that tells me, is your sugar controlled or not? And that will allow me to say to a diabetic, you're behaving bad. And to a non-diabetic, you want to behave bad. And that is where the term pre-diabetes will come out, right? So what are the risk factors? What are the complications? Again, the same thing as high blood pressure, the strokes, the heart attacks, blindness, kidney failure, heart failure, definitely circulation issues and peripheral nerve disease. That's the tingling and the numbness in the feet. With diabetes, if your sugar is really, really poorly controlled, there's a much more increased risk of infections in the body, urinary infections, respiratory infections, and then impotence is also, or erectile dysfunction is a big problem. So this is where we have to say to ourselves, do I want to go through this? Do I want to have, don't I prefer to go on a vacation versus spending money on medication? Do I want to be able to explore, or do I want to be stuck in bed because I'm amputated and I'm depressed and I don't want to go out? And these are questions we have to ask ourselves, and we have to understand from an earlier age, we have to change. And lifestyle doesn't mean what I say tonight, you say, okay, well, I'm going to exercise, I'm going to buy my shoes, I'm going to do. No, it means you have to also think about it and in context, find what you fits into your lifestyle, how you're going to mindfully make those small yet impactful positive changes on how you do things. Yeah. And that is very, very important. And with hypertension and diabetes comes obesity. Obesity is what I like to call selective plumpness. So this is based on our BMI, and that is based on our height versus our weight. But we still have to take that in a little bit with a little pinch of salt, because the reality is most of us are mixed, and therefore with the especially the blacks, and I'm black in case nobody, my children tell me I think I'm black, but I am fully black. And so with us we have heavier bones, so sometimes with if we build muscle mass as well and we have heavier bones, our weight may appear much more than expected and therefore push us over the BMI. So we take it with a grain of salt, but we do have to look at your waist circumference as well as your BMI. We all know that we not going to stay the same size. Well, most of us not blessed. I from a family, when I look at a chocolate cake, my hips start to expand, much as when I eat the chocolate cake. But the reality is, we know that we will put on weight a little bit as we get older, and it will creep up on you, ladies in the audience. Y'all all know that little belly that coming up, and you're saying, "Oh, this is all I need to get rid of," and understand that. But the reality is, if we start from an earlier age in terms of the type of exercising, how we eat in, our portion control, and so forth, we can manage our weight healthily and don't go on no crash diet, no fat diet, carnival coming. So I see my gyms full as all the time. No, because carnival coming and then after carnival they all gone empty. You know how that goes. But understand how your body feels. There's a syndrome called syndrome X, which is where we have obesity, diabetes, and hypertension and cholesterol now in this syndrome. What does this mean? What we're seeing is if you start off with even the obesity and the cholesterol, eventually with poor management and not paying attention to those digits and not listening to your body and not getting your checkups, then we see the development of the other elements such as diabetes and hypertension. So what I'm trying to explain tonight is that nothing happened in isolation. We need to make changes from an earlier time. We need to understand our numbers. We need to understand through preventative care. We need to look at all our numbers. And when you talk to your doctors, they say, "Hey, but last year it wasn't so bad." And you have to compare. Are you doing better? Are you not doing better? Are you staying stagnant? What it is you're not doing, what it is you're doing. You understand? Because this allows you not only for you to be healthier, but for you mentally to say, "Damn, I'm doing good." And your proactivity is working along that journey to optimum health and wellness. So know your digits, understand your digits, know how your body feeling, and don't be afraid to have that discussion with your physician at all. Right. Cholesterol or dyslipidemia. So when you go to a health fair, they like to stick your finger and say, "Oh, your cholesterol high, go to your doctor, you're dying." Don't worry with them too much. Again, a pinch of salt, because we need to have a full lipid profile or cholesterol profile to understand your good cholesterol, your bad cholesterol, and your total cholesterol. Your good cholesterol is called your HDL. Your bad cholesterols are your LDL and your triglycerides, and total cholesterol is, as it says, total cholesterol. So that is what one sees when they do a lipid profile. We like your total cholesterol to be below 200. We like your LDL to be between 100 to 130, your HDL above 50, and your triglycerides below 150. Does that mean if you get a total cholesterol of over 200, you're dying? No, because we have to look at the elements. We have to look at you, the patient. We have to understand what is going on with you, the patient, before we say medication warranted, or we say, "Please change up the diet a little bit more." Do we need to give some more chia seeds, salmons, fatty fishes, the fishes that give you your omegas, your sardines? You understand your mackerel. You want to use your big kingfish, your snappers. You want to know, do you do the chia seeds, the rolled oats? Understand how you need to eat, because all of that in tandem not only will help your cholesterol and raise your good cholesterol and bring down your bad cholesterol, but if you add that with exercise, and you have good sleeping patterns, and you're doing all your preventative care, you will see an amazing difference in terms of every single digit coming to a normal range. And that is what we want to implore you to understand. Now, after we speak of pressure, sugar, selective plumpness or obesity, dyslipidemia and cholesterol, then we come to cancers. And when people hear the word cancer, they just drop their hand and say, "Oh God, I'm gonna die." You're not going to die all the time, and a diagnosis of cancer does not equate death. Why am I saying this? If within our preventative care, we pay attention and do our appropriate screening, then we are much better off. So this is all a huge umbrella, and don't be overwhelmed, because this is you understanding what you need to do and what is age appropriate. So we're going to touch lightly on the screening tests that are appropriate for men. Men over 40, you start your prostate cancer screening with your PSA in your blood and your DRE or digital rectal exam, and that is done annually. Know your family history, especially, and don't be afraid to have it done. Women, and then so I'm going to do men, women, and then men and women because their cancers affect both men and women. Women, your mammogram, your breast ultrasound should start between the age of 35 to 40. However, we have to look at your family history because we may need to start it a little earlier, but your self breast examination should start way before then for you to understand what your breasts feel like. And then we do your mammogram and ultrasounds. We start them between 35 to 40, unless there's some reason we need to start them earlier. And that is done annually. Yeah. The cervical cancer screening test is the pap smear. Once you're sexually active, you 3 years after you initiate sexual activity, you have your pap smear done, your first pap smear. We recommend 3 annual pap smears. Once those three are normal and you're not a lady at the night, then based on risk factors, we say we can do your pap smear every 2 to 3 years. Yeah. Then we come to colorectal cancer screening for both men and women. We recommend the FIT being done. And again, based on family history, it will tell us how soon we can start, but we usually like to start between 45 and 50. Now, the FIT is a low cost test, but if a FIT comes up, and it's called a fecal immunochemical test, if that comes up positive, we have to do the gold standard test of the colonoscopy. And the colonoscopy, we usually start again between the age of 45 to 50. And the gastroenterologist, who's the specialist that does the colonoscopy, will then tell us how often, based on that result, how often you have to repeat your colonoscopy, right? So we know our pressure, where it needs to be, right? Below 140/90. We know our sugars, our fasting needs to be below 110, or 2 hours after we eat, below 150. HbA1c, below 6%. We know our cholesterols. We want our LDL 100 to 130, HDL above 50, triglycerides less than 150, and total cholesterol. We like it a little below 200, but we'll take it based on the profile. And we know our cancer screening tests. Those are the major lifestyle diseases that we're looking at. And these are the screening and preventative measures. So what are our steps to take? Again, we starting with the diet. A diet has to be balanced. It has to be one where you're eating as natural as possible. You are eating from our region, understanding again, especially if they're perimenopausal and menopausal women in the audience, understanding how we're changing our diets. We're eating more ground provisions, roots, vegetables. Our food should be cooked, least amount of processed foods, least amount of processed sugars in our foods, lowering the salt concentration in our foods. So when people say, I'm not eating salt, you need some salt. So low sodium, and this is where we look at low sodium alternatives. Remember, using less salt in your food, putting more fresh seasonings in our food, understanding the quality of our food that we're eating. If you see a pak choy that big and sexy looking with water glistening, run from that. You need one with a hole. You understand? If a chicken grow from an egg to a chicken in a week, run from that. If the breast looking huge and it grow very fast, run from that. That have hormones and antibiotics, and it will affect our reproductive systems and much more. So understanding, speaking to our grocers, going back to basics, our dals, our ground provisions, our whole grains, understanding that more fermented foods is what we have to look at when it comes to our diet. Exercise. Aerobic exercise is recommended at least 30 to 40 minutes a day, at least 4 days a week. And that means from running to walking, pick your poison, salsa, aerobics, whatever you like. I do all. But strength training as well, especially for the ladies out there and the men, because the men, as you get older, you can get low T or low testosterone levels and andropause, and the women have perimenopause and menopause. So when I was introduced there just now by Kellyanne, and she gave me all those accolades, I think I need to add in my bio, I'm a perimenopausal, selectively plump perimenopausal woman that is trying to stay as balanced and sane as possible. So strength training is very good for our bone health, our hormonal control and balance, and for our overall health and wellness. Yeah. Stress management. Stress management is much easier said than done. There's no doubt about it. But we have to understand how we're feeling. We have to get back and be very mindful about our emotions and understand how are we letting these things affect us, because if our body is not in consistent fight or flight, then it's in a much healthier space. Now, everything will not be perfect. There are days that you're going to lose your cool, and that's fine, but it cannot be consistently inconsistent. You cannot be always angry, always sad, always grieving. We have to have balance in terms of our emotions and how we manage those emotions, because that will then impact on the physical aspect of our bodies. Yeah. Reducing your alcohol intake. Now, this is a little touchy subject because it's very hard when people hear, well, the budget come out, yes, they increase the tax, so a lot of us might stop drinking as much. But anyways, um, you know, as I say, I take a little tips now and again, but it's about, if you're not drinking, don't start. And if you are drinking, reduce your alcohol intake. We still recommend some red wine to help reduce the cholesterol and help to boost the HDL because the resveratrol in it. But it's about you understanding and seeing how your body feels. For example, I myself, and I always share this story, that because I had a bad experience with COVID, and yes, the doctor did get sick, and yes, I did, but I lived to tell the tale and I'm much healthier now. But however, my alcohol tolerance has been greatly decreased. So, we do recommend a reduction in alcohol intake. Definitely no smoking, no vaping. Stop it if you're doing it. Don't start at all. Vaping is not a healthy alternative at all, at all, at all, at all. Right? So we need to not do that, because that also impacts on the vessels in our body. It causes vasoconstriction, which means tightening of the vessels, which will then impact on the blood pressure control as well. Know your digits. Know everything I just told you. Understand those numbers. Know those numbers, like if it's your age, which some of us might know. I'm 21 plus shipping and handling and online tax and every other tax you could put on it. And see your family physician every year. So that and your physician needs to be like your shoe. It has to fit you. It can't be something forced, because they have to understand you, the human being. They have to understand how you're going. They're not macro in your business, but they need to understand how you're feeling, what is happening, what is going on, because that is how we can then help you with the interventions to make you healthier on your journey to optimum health and wellness. So the same thing here. So these are examples of food. So I have blueberries, and people can say, but she just said eat natural and we don't have no blueberries. We didn't grow up on blueberries and raspberries. And that is true. But every once in a while will not kill you. But of course, using our local veggies, local flours, local breads, local beans, very, very important to understand, and going back to basics. I told you about the common factors. We can't stress them enough in terms of dealing with lifestyle diseases. Yeah. So we've spoken about that, but then what is different then about this? It's about holistic health. And what is holistic health or integrative health? This is about us going back to basics. It's about us using a combination of herbs, spices, different lifestyle practices, along with big pharma, if needed, to promote health and wellness. But holistic health is also very important in complementary medicine, where we bring the branches of medicine together. We're looking at the patient holistically and looking at the root of the problem, and really trying to help them make those essential interventions so that they do have happier and healthier lives. And that's no lie. So this is where we would look not only at how you eat, but then we have, like, for example, your blood type, your ancestral heritage. Did you grow up on different types of food? Where are you from? Where do you live now? What did you grow up eating? What are your family health issues? Where are where are you living now? How is your lifestyle? How is your metabolism? Are you exercising? What is your culture? Those things are very, very important. While they seem like something that is normal, and that you understand that and it couldn't be different, we have to pay attention on that, because some people say, oh, I do the blood type diet, but it's not in isolation. We have to understand just more than what type O has to eat. You have to understand type O that grew up in Trinidad, that grew up with a black family, an Indian family, a multidisciplinary family. Like me, I eat all the food around town because I grew up in Guyana, and we have 6 different types of people, and we have all kind of food, and that I eat in everything. You understand? So we have to look at that and understand, and know, back to our basics and our heritage, understand our heritage. Because if we look back at our heritage, we'll see that our ancestors were actually eating foods that were very healing. The problem is that the food industry has changed so much that it then modified our ancestral foods. And that's why now they're saying our foods are bad. But I still, for example, cook my pepper pot, happy as pappy, but I make a modification in terms of the type of meat I put in the pepper pot, and I don't eat the pepper pot as much, and then portion control. So it's a matter of balance and moderation. Definitely balance and moderation. But has anything changed? So with all that I have told you, has anything changed? Or is it the same old we talking all the time? Things have changed. What changed? COVID changed a lot of things because COVID was a huge fight or flight crisis, yeah, and brought on a lot of stress. And a lot of us came out of COVID. In the beginning, COVID was nice. COVID was sweet. We used to make doubles. We used to do everything home, chocolate cake. We didn't have to we worked from home. There was no traffic. Oh, COVID was sweet. And then the world said, we need more money. This is not making sense. For some reason, that's what the world said. And the leaders did that. And next thing you know, we back into the rat race, but it got worse. I don't know about y'all, but I find the whole wheel of work got a lot worse since we came out of COVID. And so we have to beseech all these companies and all the powers that be to let us really revisit, because everybody has to do their part when it comes to fighting NCDs, lifestyle diseases, and promoting a healthier population. And that means we have to look at work-life balance. Lack of sleep. A lot of us don't sleep as well anymore. And that is very, very important for us to remedy, because that's a root cause, again, a root problem. There are new viruses around. Every day there's a new virus. And all of these coming together greatly impact the diseases we just discussed. And so what am I telling you? Is it hopeless? No, it's not hopeless. I'm saying we have the information. We can prevent. We can do a lot more to prevent. We can do a lot more earlier so that we have the tools to prevent either the disease from forming in our bodies or the disease from making a big complication and negative impact on our lives. And that is where it's important. Preventative healthcare is not only about saying, you're good, you're good, you're good. No, it's like saying, this is what we're seeing. These are the changes. How can we make some intervention at an earlier time to prevent complications of these diseases? And that is key to moderation, to balance, and the definition of health, which is the balance of body, mind, and soul. So preventative medicals, they're your stepping stone to optimum health. There's no lie about that. It's so important. You know, people think, well, all I need is a blood test. No, you have a blood test, and then the doctor goes through that along with how are things change. Jane, what happening now? You still working here? You still have the same husband, boyfriend, children? How things going? How the money, the job, how everything, how, you know, how mommy, how daddy, and those things bringing together with the physical exam allows for optimum health, the journey towards optimum health and wellness. Know your digits, understand where you are, decide with your physician where you want to change and what you want to do. Listen to your body and set realistic health goals. As I told you, I come from a family, I look at chocolate cake and my hips start to expand. My realistic health goal is not to be a size 2. That ain't gonna happen, but it's to be as healthy as I can be. And that is me going towards my goal, looking my inches versus my weight, understanding how I feel, looking at my endurance, understanding my aerobic activity. And that is key to us being healthier through preventative medicals. Your take home messages are: see your family physician, understand where you are, understand they're your guides, they're not your crutch, they're advising you, but speak to them, take the information to them, say, you know, I hear it here, and don't be afraid to tell them you Google it. I know Google is a good thing and a bad thing, but I personally, when the patients tell me that, I say, wait, that's on Google now? But you know, it's good for us to have a conversation with our patients and understand and have that rapport. Remember, know your digits, know your digits, know your digits. Lifestyle modification is key. Diet, exercise. Choose something now. Find anything. You know, get a group, take a walk, do something. Get up and go, because with exercise, not only do we promote healthier bodies, healthier minds, and it helps with stress management. It helps with the endorphins. It makes us happier people, and that is what is important. Understand your family history, know your risk factors, and work on the ones we can change. Because as I told you, there are risk factors we can't change, and that's what's in our DNA. And then there are risk factors we can change that are modifiable. And those are the lifestyle changes that we are spoken about. Ladies and gentlemen, preventative health is not a big thing. It's not a big myth. It's not a huge undertaking. It's not to make you feel uncomfortable. It's for us to take charge. And the only way we can take charge of our health, the only way we can feel better, is understanding our numbers, and knowing where we are. I implore you, please Take advantage if your insurance, your medical insurance most times offers a preventative care. Understand that. Now, most cases it may not cover everything, but it does cover a great part and is your stepping stone towards a healthier you. So understand that. Don't let that money go to waste. Use it for your benefit because you need to know your digits, understand where you are, and start making those steps towards a healthier you. Right? I thank you very, very much. You can find me at Victoria Clinic, www.victoria-clinic.net. I'm on Facebook and I'm on Instagram, Victoria Clinic _ Trinidad. I thank you very much for your time and attention. And now I welcome any questions. I'm going to stop sharing my screen.
Dr. Le Blanc, we are always so happy to have you present, and we can always be assured of a very lively and engaging presentation. There were some moments that I'm glad my microphone was off because I was laughing so much at certain intervals in your presentation. But I mean, preventative care is so important, and a lot of people don't realize. I mean, I have to say, it's only in the last 5 years or so that I have been consistently doing my medicals annually. Prior to that, I was one of those persons, doctors only seeing me when I am ill. My mantra was, what I don't know is not going to hurt me in any form or fashion. And I'm certain there are a lot of people like that.
No, for sure. And that's the
It
thing
taught
that
us a lot. Yeah, go ahead, Doc.
no, for sure. I'm just saying you're very right that a lot of people say. I mean, I know my friends who go, "Oh God, we really have to go to the doctor now." I mean, I have friends who call me, "Oh God, I reach. Just don't give me the bad news." I mean, it's like, why you think I can give you bad news? So it's very, very important to be proactive where that is concerned.
Yeah, I tell you, I was always one of those. As a matter of fact, if my family heard me say I'm going to the doctor, they knew at that point something
Water more than flour.
I'm really not feeling well. For me to actually say I've made an appointment with the doctor and I'm going. But I will say that in the last 5 years, maybe it's me getting older. I've recognized the importance of doing that annual checkup, that medical, you know. And I'm glad that you brought up the part about the insurance, because sometimes persons think, oh gosh, the amount of money you're gonna have to spend to go and do this medical, is the blood test, is the this, the that, and I'm spending this amount of money, I don't have it. But most medical plans have that preventative care in there. And a lot of people, especially, when you're working full time, automatically you are on medical plans, and persons sometimes don't sit down and look to see, well, what does my medical plan cover? They just they just have it. They know it's a requirement of the employment that they're on this medical plan, or they've taken it out just because, but they don't sit and look at what really is covered, because in the majority of medical plans, there is that preventative care coverage. And many of you would know that at CECU, we have our own medical plan, CECU Care, insured by Sagicor. And inside of that plan, there is preventative care coverage. So at this juncture, I actually would like to invite Mr. Gary Lubin, our surgical advisor. I'd like to invite him to come on and talk to us a little bit about that preventative care coverage, and also talk to us about the open enrollment period, because as is Credit Union Month, we are running an open enrollment period for the SecuCare health plan. So it is the perfect opportunity. If you were thinking about should I, shouldn't I, it is the perfect opportunity to take advantage of this period. So I'd like to invite Mr. Lubin to come on and to tell us a bit about the open enrollment period, and also share with us a little of what kind of preventative care coverage is in the plan and how important it is, and adding on to everything Dr. Le Blanc has told us. So welcome, Gary.
Hi, good afternoon, Kelly. Just confirming if you're hearing me. Great, great. Um, just a shout out to Dr. LeBlanc. That was an amazing presentation. Even I learned a lot from it, despite being in the industry and having a lot of that information. It really hit home a lot of different things. So thank you so much for that. I think the membership would appreciate that as well. Thank you for Cannings for doing that. I think the big takeaway I took from it as well was in your closing as well, where you stated your annual checkups really are um, quite a thing that you need to have done, not just for your peace of mind, but you want to be able to pick things up earlier rather than later. And as a medical professional, you will know from both sides of it. When you pick things up earlier, they're more treatable at that point in time, but the costing as well can change drastically by picking up something in 2025 rather than letting it linger to 2027, 2028. And Kelly rightfully said, the CECU care plan, which is Canning's medical plan, does carry that preventative care benefit, which we would encourage all members to use. And as a point of fact, actually, the preventative care benefit under the Canning's medical plan is actually one of the highest in all design medical plans. So it's really a higher benefit that most medical plans have in place. So we really would encourage the members to make use of it, to be able to go and do those annual checkups and follow the doctor's advice, as you would say, to make sure everything's in place. Because it's going to give you that peace of mind from a healthy perspective, but it really could save your life as well and save you some money down the road as well. And Kelly also mentioned that during this month, which is the credit union month, we actually having an open enrollment period with some conditions applied, but it's the ideal condition right now where you can spread the information, share the information to members out there, share it to people you know who are members of the credit union. We have an opportunity now for persons to get onto the Executive Care Medical Plan, um, which is a little bit different from applying on a normal route where you'd have to go through full medical requirements. So right now, get in touch with the credit union, see the specific conditions that apply, and there's that opportunity to be able to enroll with the plan, even if you have some medical conditions. The opportunity gives you that ability to get onto the plan once you're able to qualify for it. And it's going to give you that constant coverage going forward, but not just the medical coverage, dental coverage, the vision coverage under the plan. It gives you that specific benefit that we've been speaking about for this entire duration here, which is the preventative medical care falling under the plan. And that's going to provide so much comfort to a lot of the members in that when you do your annual checkups, and I can say that from a personal level now, having gone through several issues over the last couple of years, doing your annual preventative care checkups really does open your eyes to certain things that you may have ignored and taken it for granted. And suddenly you realize these things need attention. So I encourage the members that are on now, I encourage you to share it with other members, share it with people you know who could be applicable for it. But let's get this going. Let's be able to enjoy the SecuCare medical plan, not just to be able to help yourselves, but help your family as well. Because a lot of times, injury, illness, and things like that wouldn't just affect you. It's a family epidemic sometimes because your family has to go through it with you as well. So my encouragement, the open enrollment runs right now until the end of October. So let's take advantage of our opportunities. See how we can get onto the medical plan, take advantage of all the opportunities, but specifically you will then have access to that preventative care, which really could save your life at some point. Thanks so much for everybody for being able to share the information. If there's anything anybody wants to find out, I'll still be here, so it's not a problem.
Thank you
And
so
Mr.
much,
Lugan, do you
Gary.
offer the card? Is that your card swipe situation with your preventative?
Yes. So the SecuCare plan does have the swipe card, what we call the Carry Care swipe card. So it does afford that ability to members once they're enrolled onto the plan. They issue the cards, not just if you're enrolled for yourself, you have a card for yourself. If you're enrolled for family or other members, they will also have a card to use as well. And most places, as you would probably well know as well, do have preventative care packages that allow you to use the card. So it's really no hassle or anything like that. But even if the place doesn't have it, or it's your personal doctor and you want to continue that, you just make the claims for it.
Yeah, that works out very well, and especially with the cards, and if the doctor's on the panel approved by SAGICOR, then the patient pays less, and that helps them a lot. So, for example, we accept the card, and you see a bigger uptake in patients accepting and doing their annuals because they know, okay, this is covered, and it's very important
Correct.
to look at what tests are covered as well.
Correct. Yes, that's absolutely true.
Yeah, so that's another encouraging point for everyone to please go schedule your annual medical if you haven't, because you get to use the surgical card once you're on the plan, obviously. To get the card, please join the CECU Care plan. And if you are on the plan already, please utilize your preventative care. That benefit is there every single year so that you can actually do your annual medical every single year. And I mean, it's nothing to be afraid of. And, there's so many cases where you hear people say down the road, gosh, if I had just started doing my medical earlier, maybe I wouldn't be in this particular situation. We come across so many of those stories. You could ask anybody in the office. I'm always walking around encouraging everybody, please go do your medical. Please, have you scheduled your annual medical? Have you done this? Have you done that? So I'm always encouraging everybody to please go.
Yeah, and I'll just add in one more thing to that, Kelly. From an insurance perspective, we've been in this industry for a long time, so we've seen it all. Um, there are many times persons go and do their annual checkups and you pick up a cyst or a lump, and that's treatable at that point in time at a minimal costing as well. And if it had gone unnoticed, we're looking at cancer, different stages down the road, possibly. Um, and then we know what happens then. You're faced with a lot of different scenarios depending on the stage of cancer. So you're absolutely right. Encourage everybody, all the members of the plan, that preventative care benefit. It's for you to be able to use. And Canning's providing it as part of the plan is an incredible thing. So make sure the members use it and use it well.
I unfortunately had a patient just this week, this from last month to this month, and he came to me and he says, I just thought I should do a PSA because you told me to do my PSA. And I said, okay, do your PSA. So he came with the PSA and it was 5.79. I was like, it's a little over 4. I go, well, well, what's your family history? And I go, you know what? Let's retest the PSA. We've had a couple of months. Let's just see, because it could be over 4 for a couple of reasons. He goes back, he checks it with me this time, comes back at 6.9. I go, ooh, okay, right, okay, no problem. So I go, well, you're getting younger, your prostate gets bigger, PSA could go up. Don't panic. But you know what? Let's just do an ultrasound. I said, because I did the DRE, I'm not feeling anything, but let's do an ultrasound because 2 and 2 don't make 4 in medicine. We've seen it going up. Again, able to compare results. I get back the ultrasound and it goes, yeah, we're seeing something. We need to biopsy it. So he comes to me like, oh, don't worry about it. Let's manifest positivity, and he's looking at me and I'm like, don't worry about it. But I'm here, if we catch anything, screening means early detection. We got this. We got this. You know that he's now been diagnosed with prostate cancer. So then I have the conversation with him and I'm like, are you sitting down? Are you okay? Because I'm about to travel and I have to give you this news because you've received and you've seen that word carcinoma and you've chat GPT'd it and now you're freaking out. So I go, well, and then you explain it, but the reality is his treatment regime and his options will lead him with a much better life and much less costly than if we had not paid attention, not tested, not done that work. So, there's always a silver lining, so to speak, right? So he was, in retrospect, he looked, he goes, well, thank God you sent me for this, and thank God you said to do this. And I was like, well, thank God you started doing the PSA because I said to do it, So it's just so for the men out there for everyone to understand that preventative care is amazing. It gives you a lot of comparison from doing baseline understanding. We understand the patient, and it's very important to understand those readings.
And it at least it helps you worry a little less. Dr. Google, I always, you can ask them in the office, say, Dr. Google will kill me one day, because the minute you put in something, Google will tell you that at that point you're dying.
Well, yeah, and
That's
you
the
know,
extreme that Google will go to.
that's
And
a
if
good
you
and bad
happen to
thing.
worry at all, like me, I worry about things. I'm like, Google will just kill me one day. So forget Dr. Google and just use your preventative care and go to the doctor and do your annual medical.
And listen, I want patients to understand that this is something where we know, we have that intuition and we need to listen to our bodies. So you can't be fearful, because in this day and age, there's so much that can be done for not only survivorship but healthier survivorship. You know what I mean? And like, my husband got sick. He's probably gonna kill me for sharing all his business, but that's such his life. He doesn't work here. So he got sick in 2023, and I had to use our insurance, and that helped, because it was over $1 million. You know what I mean? And so, I mean, he's great now, thank God. He's still there to bug my ass, but the reality is that you see the benefits. Although I usually laugh and tell insurance agents that they're all schemers, but I appreciate them now. I really do. And I'm not being paid by Sagicor in any means or fashion to say this, but I do also recognize how good Sagicor is as an insurance company as well.
Yeah, that I will definitely say, because we would have, when we just started CECU Care, we were with Sagicor, and that kind of service that we received and the benefits that were attached to the plan, they are really good. We have seen a lot of members benefit from the Sagicor plan in the earlys, and even now. I know we left Sagicor for a little bit and we're back a couple months now, and even now you're seeing a lot of our members benefiting from the surgical plan. So if you're not on the CECU Care plan, and you meet the criteria to come on during the open enrollment, I mean, I'm encouraging everyone. Remember, once you're a member, you can look at if your children, your spouse, they can also come on as dependents, that kind of thing. So you can look at those options, because I mean, healthcare, it if it's something serious, insurance will help. Let's simply put it that way. Yeah, because there are times when, let's be real, you do have to go to private. You can't always go to the public hospitals. You have to go to private sometimes. So the insurance, I mean, you hope and pray you never have to really use it, huh? And that's the thing that a lot of persons sit and think, especially the younger. So we always try to encourage our younger members to get insurance, but and for fear of making myself sound old now, the younger persons think that they are invincible and nothing in the world is going to happen to them, and then something happens. They think, oh no, I could live life. I don't need insurance. Nothing's gonna go wrong. But then, you read so many stories about persons. I always remember reading this article about a young mother who, she referred to it as she was taking a quick mommy shower because the kiddies were sleeping, or whatever it is, and she was taking a quick mommy shower. And she just felt this lump, and she was young. She's I mean, not was she's young, and she felt this lump, and it was cancer. Now, thank God, caught it early, and she's gone through the treatments, and she's well, she's surviving. But a young person, and thank God she had insurance, because those treatments they're not cheap. They're pretty expensive. So I mean, all of this is not to scare anybody, but again, prevention, better than cure, right? I know we've been doing a lot of the talking. For members who have logged on, do you have any questions? Anything you'd like to ask Dr. Le Blanc or Mr. Lubin? This is the opportunity. You can use the chat. So we have Jacqueline Hyacinth has raised her hand. Can we unmute her mic so that she can ask her question? Jacqueline, are you able to unmute your mic by chance? No. Let's see. Yeah, you should be able to unmute now, Jacqueline.
Thank you. Good night, everyone.
Good night.
Doc, this is for you. I recently had to do some tests. And sometimes you're watching the beer in the fridge and you don't drink at all, eh? But the beer watching you for like a month or so, and you decide you're going and take a drink of a beer, and then the next day I had to do the blood test. So I just got the results back, and I'm seeing my amylase. Am I pronouncing it correctly? At 114, and the range is 28 to 100. Would that be because I had the bear? Should I do it over? Or, because again, yes, Dr. Google.
That's such a typical question. I love it, Jacqueline. So first of all, that bear was calling your name. I usually just pour it
Yes.
on my rabbit or my beef to tenderize it. But hey, that bear must have been good. No. So that bear is not what raised your amylase. So amylase is it's an enzyme that is produced by the pancreas, and it helps to break down protein. So the bear is not what raised your amylase, but what happens now? We need to find out what your amylase was before. And if we don't know that, then what we use is your 114 as the baseline now. And within 2 to 3 months, repeat the amylase. And if we
Okay.
see the amylase staying still or going down, then we repeat it again to make sure it's going down, because your pancreas could be irritated for any reason and therefore increase your amylase. Yeah. So we
Okay.
would have to look at, are you on different types of medication? If you're on blood pressure medication, on diuretics, some supplement, because Google tell you buy everything under the sun, from magnesium glycinate to thionate to threonate to rigonate and everything under the sun, and all these so-called supplements. Now, don't get me wrong, I'm a herbalist, so I do herbs. But you see, when people go into the supplement world now, all the different supplements can affect the liver and the pancreas and other organs. So we have to really, it's about moderation, yeah? And so I tell people, when they come and tell me they're taking 10,000 supplements, I say, well, it's best you just take one pill, right? Because you're now driving me insane. But, so one would have to look at your individual circumstance, but this is a very common issue that we're seeing now. And so, Jacqueline, it could also be that if you had COVID, post-viral, that has caused just an increase in the amylase. So the next step is to repeat the amylase within 2 months, and then your physician should be able to compare. And if it's still elevated, and remember this, I am not your doctor, I am not knowing everything, so please don't blame SAGIC or me or CECU for this. But generally, after they do the second one, then they should send you for an ultrasound of the abdomen, or a CT scan of the abdomen to see what your amylase is looking like.
Well, I do have
Yeah.
to do the ultrasound. The ultrasound,
Well,
I still have to do that. So,
right.
okay.
And then make sure you go to a reputable ultrasound place. So again, these people do not pay me. But I do recommend Caribbean Radiology on Eastern Main Road, which is
Yes, I
opposite
know.
Wassa. So I
Yes, I've set
recommend
up with
them
them
for
already.
Oh, well, there you go. So Sakai. And then you take it from there. Ultrasounds are very subjective, but they do good ones. And then if they need to do a CT or recommended, then you do a CT scan. But don't panic yet. 114, I've seen high and it comes down. So it could be anything from gallstones even. So don't panic yet. Yeah.
Okay, good.
Again,
Thank
not meant to replace your doctor's visit, and I am not your doctor, and I have not
you.
seen everything. So please know that is me giving you some good certified Google information for you to go to.
Thank you so much.
You're most welcome.
Sorry, we have a question in the chat. What advice would you give someone dealing with high blood pressure, Doc?
I was gonna be rude, but I'm gonna behave. I was gonna say something real rude, but I'm trying to behave myself and have decorum these days. So somebody with high blood pressure. I mean, really, A low sodium diet. It's late. So a low sodium diet. So what does that mean? So I tell people, for example, if you're cooking for 3 people in the house, you take 3 teaspoons of salt, you put it in a jar, and that is the amount of salt that you can use in the total day in whatever meal. That is it for the day, and that is called a low sodium diet. So you have to start off by looking at your diet, the amount of processed foods, those hidden sugars and those hidden salts. So like, the processed salamis. And again, I'm not calling any brands and I'm not attacking anybody. I'm just giving you the information as I get it and that I know. So we do have to look at, you look specifically at when there's nitrites and nitrates especially. And when you see a lot of words you can't pronounce, then maybe run. It should be like 2 3 ingredients. So when you see the monos, this and the MSG and the and the words you can't pronounce, maybe you should run. Though don't get me wrong, I love a good hot dog, but I can't eat that every day. You're gonna have a problem. So you look at your diet, look at the quality of food. Laughter, stress management. Anybody who knows me knows what my practice sounds like when I'm in it. Exercise is key to blood pressure management. And understanding, like, so if you ask me as an integrative practitioner, I always tell people start with simple things like ginger, the turmeric. Everybody telling you drink this and drink that. Remember that when you drink turmeric and ginger, maybe do it for 6 weeks and take a break, because your body, those herbs and spices are very potent, and therefore you want to give your body a chance to see where it's at with the ginger and the turmeric, using simple things as tulsi. And for those who don't know what tulsi is, Google that. Tulsi is an amazing plant. It's a plant used by Indians for prayers. And they say it only grow in your yard if you're a good person. I had a lot and then it stopped growing. I assumed I became a bad person, but I assume it's just a cycle of life. But I must say Tulsi is amazing for supporting the body, for pressure, for sugar, and for muscle relaxation and sleep for all the perimenopausal and menopausal women out there, my ladies. I had a whiplash injury and Tulsi helped amazing with relaxing those muscles. I don't have sleeping problems yet, knock wood, knock everything, but I sleep on a rock. But Tulsi definitely gave me a sweeter sleep as well. Using besides Tulsi, you have ginger, turmeric, Tulsi. I'm giving you some easy ones, including cinnamon, looking at your how you cook your food, shadow benny, using cucumber water you as a diuretic, Karaili as well. So those are a few things. But for maintaining blood pressure, definitely I see the benefit in bringing all of that together with diet and exercise, and how you sleep as well. Your sleep is so important with hypertension because it keeps your nervous system at bay, and then it works because we have a part of our brain that we can't control, and it's the autonomic nervous system. And that's what controls everything that you think you control it. So all of who think they alkalinizing and alkafying and acidifying, you're full of nonsense, because it's your brain deciding how acid and alkaline you need to be. So that's a whole different topic. But I will tell you, from the tip of your tongue to the tip of your bum is not controlled by you or how much alkaline water you drink. It's controlled by a part in your brain. And therefore, if we sleep and we give the time to our neurons, it will control and help to control everything, and therefore at that same time control your blood pressure optimally.
Thank you, Doc. I think the next question will be for you, Gary. So what are the current insurance plans for CECU members? So that's talking a little bit about CECU care in a nutshell.
Well, the question mentions what current insurance plans available to CECU members. So really the CECU care plan is the flagship medical plan then for the credit union. If members want different types of information on different types of plans, we can always do that and gather that information for them, and you can share it with them. But for right now, the flagship is the medical plan, which would provide them with medical coverage, dental, vision, and the most important one, the preventative care. But in terms of the other items like life insurance, critical illness, different items like that, we can always gather that information and share it with the members at a later time.
Sorry, are there any other questions for Dr. Le Blanc or for Gary? This is your opportunity. Doc, I was laughing when talking about that, how sleep is important. because you know me in my sleep.
So, I like to start
I
off
will
with
go
things
for
we
weeks and
find
it's
it.
good. And then all of a sudden, 2
Yeah.
o'clock in the morning, every morning, I'm waking up for a very brief time and then I manage to go back to sleep.
So I
But
mean, this is where the herbs, and as you know, I do acupuncture. I mean, I guess it's a shameless plug, but I guess that's why I'm here, anyways. And Sachikor is not covering acupuncture yet, but we're working on it, right, Sachikor? Yeah, we're working on that. And so acupuncture, herbs, meditation, yoga, those things are very important. And Kellyanne, I mean. I was laughing the other day because and to the men and Gary, I have no shame in my game because I am a perimenopausal selectively plump woman. When I see I'm ovulating or just before my period and I wake up at 3 o'clock and I'm having a little night sweat, I go, oh, here we go again. Because according to traditional Chinese medicine, our liver meridian is one of the meridians that is going to be affected as our hormones are changing, and that's the time for restoration of the liver meridian. So Kelly, you're not Kelly, and you're not very far off in why it's happening. And so then I say, oh, let me go take some herbs, let me go do something, stick myself, so it's all a process, and I think it's important for us to embrace that transition as well.
And Doc, by the way, so our CECU care plan, and Gary is here to attest to this one. Our CECU care plan covers acupuncture. Thank you very
Woo!
much.
Yes,
I'm
it was built
impressed.
specifically with Kelly in
I'm
mind.
I'm impressed. I'm impressed. Oh my gosh.
So
And guess what?
our CECU
Ah,
care plan covers acupuncture.
by a
Thank you,
certified
Gary.
practitioner, and it's only one in the country right now, and that's me. Oh my God, more patients.
Once you get your
Referral.
reference,
Yes,
yes, your
yes, yes.
referral, you can claim for
And as the,
coverage.
and as the doctor mentioned, it's not something that's on medical plans most of the times, but
That's
it was
correct.
built specifically for cannings. So it is a part of their medical plan, which is very rare in most instances.
I think I'm gonna join Cannons now.
Yeah,
I'm gonna
yeah,
talk to
Doc.
Kelly.
We
I'm gonna
we've
talk
been
to Kelly
trying to
offline
organize this
now.
a while now.
Yes, yes. I gotta do this. Budget just come out. Yes, I need to work on that fast and furious. Yes, because I might need to buy some more super gas and something. Yeah, I'm gonna come to Cannons. I need a
I
loan for
saw
something.
I saw Alyssa had her hand up. Alyssa, are you still there?
Alisa.
Do you want to ask a question? Are you able to unmute your mic? Alyssa, you should be able to unmute your mic to us.
All right.
Yep, yep, there
A
you go. We're
pleasant
hearing
to
you.
each and every one of yours. Doc, a question here with a hypertension, right? And they have this new thing, like I'm gonna ask you, HA blood pressure support. What is it good? Well, I started to try it, but I've not really seen any difference. I'm not really seeing the pressure going down. But I just
Let,
asking, is it
let,
good
let,
to
let me let me Google it and see what it have in it before the people kill me. Hold on. AJ. I know the AJ products, eh? So let me see what it have in it. Hold on. You see how much pressure you want to put me under? You have the bottle, you could tell me what in it.
um just now?
Oh, look at here, look at here. I see it here. Potassium citrate. Girl, get some cucumber water. It's a purple bottle.
Yes, it is.
Yeah, yeah. Mhm. This is being recorded, so I'm going to say very diplomatically, let you know, we could try other things. Yeah.
Okay.
Look at your
Okay.
diet. Now, the reason I'm telling you that, right? It has potassium, it has ubiquinol, if I'm not mistaken. I'm seeing CoQ10 and L-arginine, right? And
Yeah.
basically, and something else, I'm seeing it here. So these are all elements and minerals really. And the reality is that blood pressure management, we have to look, Alicia, at why your blood pressure is high. You understand? And
Yeah.
understand. So there are actually herbs as well as medication that will target high blood pressure. But when you talk, if I don't know if you're on medication, and I know you can't share all your medical information on on this platform. You understand? But if you're not on medication and you're exercising, eating right, but you have a high stress job or you're not sleeping right, you have to make those changes. But when it comes to herbs that we want to use to support, and I always use the word support. Go ahead.
Okay.
So I would go with cucumber water. I would go with tulsi. I would go with ginger, turmeric, cinnamon. I mean then there are other herbs that I would use in my practice because I formulate. But like if you want to say, well, can I go to the pharmacy and pick up? I won't tell you that no, because again, I'm not your doctor. I ain't see you and you're gonna sue me if anything go wrong. So, but that being said, there are herbs that support blood pressure, but we have to look at the big picture. And so it's always good to get a good, in my case, and it's not that I need you to come to me or want you to come to me, but is that if you find a good certified medical herbalist, and that's a very few of us in the country, for them to do a full diagnosis and workup to be able to say what it is that you need. Like in my case, I would do a Chinese consult, pick out the patterns, and then make a formula for you and use certain herbs. So like there are herbs that we don't even have growing normally. But I would say, Alicia, starting from how you sleep, because that could be a big thing. Yeah. And try
Okay.
the cucumber water, which is cucumber slices in a jug
Yeah.
of water. And you drink 2 to 3 glasses a day, and that's a diuretic. And garlic, I mean, don't discount garlic tea. Garlic tea is amazing for the pressure as well. So I would use those things, and using the sour sop as well, and the pomegranates and stuff like that, because to me those will do better than me taking a tablet for CoQ10 and potassium and these kinds of things.
Okay, all right, thanks. And I could come to you because I work at Marcy and I did come the beginning of the year. So I could come to you to see about this pressure.
And I take
Thank
your
you.
swipe so you could come to me. I'll be back in the country in November. Don't cry out. I told everybody I was going to be out for a while. I have a life too. But yes, you can call and make an appointment, and then we can take it from there.
All right, thank you so much.
You're most welcome. And you could WhatsApp me. Kellyanne has my numbers as well in case. But 741-7515 is my WhatsApp. I'll take about a day to respond to you till November because I'll be in a different time zone. But then I could always tell you who to WhatsApp. Actually, I'll put my receptionist's WhatsApp number in the chat because she's better than me because I'm a little delinquent sometimes. Let me see if I can write that. So it's 3508126, and her name is Giselle. And you can always tell Giselle what you're coming for. Yeah, but definitely we can help. So maybe use it out, it won't kill you because you spend your money, but then don't buy another bottle.
Do we have any other questions for Dr. LeBlanc or Mr. Lubin? I know we're nearing the wrap up time. So this really is your opportunity. Now I will tell you that the recording. Oh, Jacqueline, hi. We have another question from Jacqueline. You should be able to unmute your mic, Jacqueline.
Okay, great. Yes, hi. Dr. LeBlanc, you said 140/90 for blood pressure, which surprised me when you started talking about that because usually you would have heard 120/80.
No,
I mean, I've
120/80
always
is
heard
the
that.
normal pressure. You're
Uh-huh.
considered hypertensive if it's over 140/90.
Okay, got you.
Yeah. So don't you wanted to make me lose my license now? 120/80. So
My
one.
apologies, my apologies. I'm happy that I got it clarified.
Oh God, I hear how I would have. So 110/120/60/80 is normal blood pressure. Now, even though I'm selectively plumb perimenopausal, my normal pressure is 90/60. So then you must understand what your normal pressure is. Because, for example, if I'm not feeling well and I go into a hospital and they get my blood pressure at 130/85. And they say, nah, man, you ain't dying of pressure. But my systolic is more than 40 above my normal, and my diastolic is more than 30 above my normal. And therefore, it is a zone of elevated high blood pressure for my normal. You understand? So important to understand what your normal is, especially as well if when you go in my office, and it don't happen often, but it does because there's a DR in front of the name and the pressure zoom up. You're able to say, my normal pressures are XYZ. I just tested it with my machine. Bring your machine. Sometimes it helps if you take your machine with you to your doctor so they could see what your readings are and we can measure to make sure your machine is working as well and not giving you a false sense of security.
Right. Okay. Thank you so much. Thank you so
You're
much.
most welcome.
Doc, if you might have some patients calling you.
Oh Lord, well, I probably could handle it, I think. Yes, I'll be in the country the rest of the year. My husband ground me after a while.
Well, if there are no more questions, I'm going to start the wrap up. So, Dr. Le Blanc and Mr. Lubin, we really want to thank both of you for giving of your time to facilitate today's session. Just letting our members know that today's session has been recorded. It's going to be placed on our website, www.mysecu.com, along with today's presentation, so that it's going to be there for future reference. Now, we do have another very interesting session coming up on October the 23rd. It's entitled Transitioning to Retirement. It's going to be a lunch and learn session, and that's going to be facilitated in partnership with the NIB. So you don't want to miss out on that. So please go to our website and register, or go on to our social media pages and register for that lunch and learn session. That's going to be next week. Thursday, the 16th of October is Credit Union Day. So we are wishing every one of our members a happy Credit Union Day in advance. And we do invite you to pop down to the office at some point during the day, because we really do look forward to meeting our members and greeting our members, especially on that specific day. So we look forward to seeing you guys on Thursday. And we have now come to the end of this evening's webinar. So we'd like to thank everyone for joining us. We do hope that this session has been quite informative and helpful. We thank you once again for attending, and we wish everyone a good night. Thanks, everyone. Bye-bye.
Thank you. Bye.